when I first heard about the talk, they told me an hour and a half, and so that I kind of planned on that. And then I was looking at the program, and it's an hour. So then I drank a lot of coffee so I can talk really fast and get through and make it all happen. But then I was told that the hour is actually a soft ceiling, so we can actually breathe, and I'll have to let the caffeine burn out and while we talk. So what I'd like to do tonight is I'd like this to be kind of fun, kind of informative, and I'd like to move through at a pretty good clip. But if there's timely questions, if you got a quick question, I have no problem with that. If it's a problem we get stuck on and get on a rabbit trail, I'll have to divert and come back to the lecture, and we'll try to answer the rest of the question later. So I have no problem, because we have the slides, we've got pictures, and if you've got a question, then we can try to answer it as we go. So that, so that's fine with me. And then if you do ask a question, I will read for the video guy, we will repeat the question to make sure that happens. I do have a favorite author, and so what I thought I'd do tonight is I purchased 4 copies of Matthew Walker's book, Why We Sleep. And it's an absolutely fabulous read from multiple perspectives. But it's a great, great book. And so 4 of you will walk out the door for the free book. Yay! All right. So, as she said, my name's Clay Triplehorn. I'm a family physician. That's where I started out. And then I'm also trained and board certified in sleep medicine. And I approach sleep from a family practice or whole person kind of perspective. And the issue of sleep, for me, has really come up because of the changes in technology have really exploded in the last few years in terms of our ability to understand the physiology and the neurobiology behind sleep. It's absolutely astounding what they can know about the brain now. So it's the advent of PET scanning, the advent of functional MRI. It actually allows us to take pictures of the brain and actually see what the brain is doing in certain situations. They're getting so good at this. I read this article the other day, and it was like a New York Times thing. But they actually have a device now using magnets they can put on the base of the skull while you're sleeping at night. And if you were dreaming of a fir tree or a fire truck, they can actually guess with a fairly high degree of accuracy at least the image of what you were thinking about. Oh, no. Isn't that insane? But what's really cool is it gives us a picture in our own physiology. And the interesting thing about sleep is throughout human history, there's all this mythology that has been built up over time, and all of this social habits that get formed and cultural habits that get formed. And none of it's based on reality or true science. So now, in the last 5-10 years, we now have the ability to actually peer into what's going on in our skulls at nighttime, which we spend 30% of our time sleeping. And we actually see what's going on, and it's pretty cool. All right. So I always like to start from the beginning. So sleep is a fundamental characteristic of being alive on planet Earth, whether you're an earthworm or a human being. And there's the basic drives that we all know: eating, respiration, reproduction, hydration, I missed that one, and then this one, sleep. Now, some of these basic drives become readily evident pretty quick. If I cut off your oxygen supply, within a pretty short period of time, you realize there's a problem. Same thing's also true if you stop eating. You can stop eating, and in 2-3 weeks, it's a problem. And same thing's true for drinking. Usually a week and a half is about as far as you can go without drinking, and then it's a serious problem. Sleep is the same kind of drive, although the impact is slower. And as we'll see this evening, the impact on our physiology is pretty broad. It affects everything from our eyes. Somebody was talking about eyes and how, eye problems and things like that. So we now find that there are some sleep disorders that actually can affect, your risk for developing glaucoma or macular degeneration. And so sleep apnea is the eye disorder, or is a sleep disorder that actually can cause some of these eye disorders. So the way sleep impacts our health is great, okay? And it's really appreciated. But if you think about this from a biologic perspective, like going back, several million years ago, why is it that life actually had sleep, be of such priority? Because it doesn't make sense. Because when you're sleeping, you're at risk for predation. You're not out foraging for food. You're not reproducing. They're not taking care of the young. It's kind of an odd mandate, and that this has happened. But it's ubiquitous in almost all species. I mean, granted, in a couple species, like jellyfish and sponges, are they really sleeping or are they not? Who knows? But certainly from the earthworms up, sleep is pretty much ubiquitous. And the bigger your brain, the more complex the neuronal network, the more you need to sleep. And it becomes a greater priority. And so in some respects, sleep is the price you pay for being awake, in short. And so human sleep is really interesting. It doesn't come from one center of the brain. There's a whole group of nuclei that actually promote wakefulness and promote sleep. And actually, sleep is actually the default. So if things aren't going well, the sleep nuclei actually dominate, and you'll either be sedated or asleep. Being awake is a harder process, and this here. But these are two opposing systems, and they're very elegantly interconnected with each other. So what this creates, these nuclei and these opposing systems, is they create our circadian rhythms, the tendency to be awake during the day, and our tendency to be asleep at night. Okay, now there's several balancing systems in place, but the one that makes the most sense for tonight's talk is this adenosine levels. So adenosine is a compound that builds up in your brain during the day, and then it kind of wears off and becomes metabolized at night. But it's the adenosine levels that occur in the late part of the day. That's what actually is the starting pistol, or the starting gun for the whole sleep cascade to take place, so that you're able to fall asleep. Okay? So this is just for example. So this is why, for example, if you've got these adenosine levels building up during the daytime, and then you decide to take a nap, say during the NFL season, the football game's on, and you fall asleep, and then you find that it's harder to fall asleep that later that evening. What happened was you lowered the adenosine level, so the bedtime was later. Okay? So we'll talk about that. But anyway, there's this very elegant system that happens at night. Okay? On a nightly scale, then we also have sleep cycles that take place during the night. And so you've heard of non-REM sleep and REM sleep. And so basically these stages are determined by EEG patterns. They're not randomly decided what stage somebody's in. These are actually based on EEG patterns and the brain waves that our brain puts together at nighttime, and then we can decide what stage of sleep you're in. And so typically the pattern is you start off awake, then stage N1, N2, N3, REM, and then the cycle starts over again. And these are 90-minute cycles that take place all night long. And people typically, you have 3 to 4 cycles a night. And it's interesting that not one stage is more important than the other. All of the stages are important, and the amount of each actually, it's the quantity of each that actually determines how healthy it is for you, which is interesting. All right, so normal human sleep. So it's pretty well established now that humans need 7 to 9 hours of sleep. You'll hear, at the coffee shop or at the bar that people will, I can get by with 5 hours of sleep, and I've always been that way, blah, blah, blah. And it's really not true. It's true that people can get by with less sleep, but that's just getting by. That's not living optimally. So that's, it's not optimal sleep for your brain, not optimal sleep for your cardiovascular system, and that kind of thing. And so when we've actually looked at this, it's 7 to 9 hours, and that's a pretty hard ceiling these days, at least certainly in the sleep literature. The circadian, so that's the amount of sleep. The timing of sleep can vary from individual to individual. There's people that what we call larks. So the larks are people that actually prefer to go to bed early and get up early. So I'm a lark. I typically would go to bed about 9:30, and I can't help myself. I got to go to bed, and off to bed. But I'm up at 4:30, and I cannot stay asleep for the life of me at 4:30 in the morning, and it seems to be getting worse as I get older. My wife and daughter are night owls. If they have their way, they would be very happy up cooking in the kitchen and puttering away at night until the wee hours, but yet they would like to sleep in till late. So the timing for each of us, we each have an internal clock that actually determines the timing of our sleep. And that internal clock actually is a clock that it's the master clock in the suprachiasmatic nucleus right behind your eyes here. And it actually is the clock that regulates the timing of the function of every single cell of your body. And I'm not kidding. So every skin cell, every liver cell, every heart cell, the timing is regulated by this nucleus right here. And it's about the size of a period inside this book. And it controls everything. And it's amazing. Okay, so it can control, your insulin levels, or your blood pressure, or your body temperature. All of that is controlled indirectly by this nucleus. Okay. If you don't get enough sleep, so what constitutes sleep deprivation? So sleep deprivation begins with as little as 30 minutes off your target sleep time. So basically, if we stick by this rule here, 6.5 hours a night, you are becoming sleep deprived. Okay, and it's cumulative from night to night to night. It adds up. It doesn't go away the next morning. It keeps going. So, for example, there was a study done on college students a number of years ago. They're easy to get you to do what you want, and they can be paid off pretty easily. And so basically the study was, what was the impact of sleep deprivation? So to measure the impact of sleep deprivation, we use a tool called psychomotor vigilance testing, which looks at reaction time, how quickly you can respond to things, how quickly you can make decisions, and that kind of thing. So it's a nice measure of cognitive skill. And so the first part of the study, they actually did the psychomotor vigilance testing with the kids getting 7-8 hours of sleep on a nightly basis. And they measured that, okay? And then they had them sleep 6.5 hours a night. Just a half an hour off their target sleep time. The college students didn't really seem to mind it at all. And then they repeated the psychomotor vigilance testing. And what they found was, after 1 week, 5 days, of 6.5 hours of sleep, they were as sleep deprived as somebody who'd been up the entire night. All right? If you compared that, and we'll show you another slide here in a minute, if you compared that to somebody who is drinking alcohol, that level of sleep deprivation is the same level of impairment that you would have with a blood alcohol level of 0.08. You would be legally impaired just sleeping half an hour less a day for 5 days. All right? The catch-up time is 3 to 4 days, period. It takes that long to catch up from sleep deprivation. So this is like your taxes. It's easy to dig the hole. It's hard to fill it in. All right? So these are what are core rules when I work with sleep patients and family practice patients that I try to drill home. Because it makes a difference in patients' decision making. Like if they know, like staying up and watching Netflix at 2 o'clock in the morning takes 3 to 4 days to catch up, that changes how you think about things, especially if you're studying for a test or something like that. It matters. All right? So the next thing I'd like to talk about is, we've talked about a little bit about sleep physiology. We've talked about what norms are. So what are the potential health concerns and risk? So in terms of cognitive performance, I was talking about PET scanning and functional MRIs in terms of how it impacts our brain. So this is a brain, and this is looking at a functional MRI. And so functional MRIs actually label glucose or another molecule, and you basically can measure the brain's metabolism as it's doing various things. And so obviously the areas that light up are most active, and the areas that are not lighting up are not so active. All right, so this is the front of the brain, the back of the brain, and this will be the left and the right. And these are the various, right here is the prefrontal cortex. So prefrontal cortex is what helps you make good decisions and not avoid bad decisions. So it's integral in your decision-making process. These areas in here have to do with your ability to interpret sensation, like am I holding a slide advancer in my hand or not? So it helps you determine that. So these areas are typically pretty active when we're awake. When you're sleep deprived, you can see how so this is also in the awake brain, but look at how impaired that is. It's dramatic, it's incredible. And so this is what it looks like when we start looking at this on these scans. And by the way, I would point out, look at the prefrontal cortex. So this is the area that helps you make good decisions and avoid bad decisions. This is the part of the brain that allows you to be ethical. Like, if you're a soldier in a firefight, you don't shoot the good people, you go after the bad people. Or, how do you make good decisions? And so we know that in patients or people that are sleep deprived, they tend, if they're very sleep deprived, they will make not so great ethical decisions. So in healthy adults, when we look at cognitive performance, it seriously impairs your mood. Irritability, lack of interest, decreased motivation. You typically become inflexible in your thinking. You get pretty boxed in. It's hard for you to be creative and think outside the box. A lot of difficulty with complex reasoning and problem solving. Diminished learning of newly learned motor skills as well as new ideas. So the ability to pick up new tasks like eating with chopsticks or learning physics or something like that. All of this is impaired. And it's impressive on how much. Some of the studies show up to 30% decrease in performance in your ability to learn a new skill if you're sleep deprived. Okay? We touched on decreased ethical and moral decision making. Very well established. There's a couple studies looking at police officers and soldiers and looking at that. You tend to have more frequent lapses in accuracy, so you're not as, so if you're typing on the computer, you may actually have to use the spell check a little more frequently. Anxiety threshold, people who are sleep deprived tend to be a little more anxious. If they're experiencing difficulty with chronic pain, increased pain threshold, they're more prone to accidental injury. And then in severe sleep deprivation, you can actually start getting visual and auditory hallucinations. Okay. Now there is a little bit of variation depending on your circadian type, whether you're a night owl or lark. And again, the recovery for these in terms of, do all of these recover at the same time? No, they don't. The learning new skills and the complex reasoning actually is delayed. It can take 3-4 days, and there's some people believe it can take weeks to actually recover normal cognitive function if you're sleep deprived. If you have a mood disorder, so I brought up mood disorders because it's common. Patients with mood disorders, this whole effect of the sleep deprivation is amplified. It's increased. So chronic sleep deprivation actually worsens depression and anxiety. It can actually worsen mania in bipolar disorder. Again, it can create or push delusions, so it can be worse for patients with schizophrenia. And the interesting thing here is in patients with depression, so in patients with acute depression, if you sleep deprive them, they actually get better for the short term. And then if it becomes chronic depression, the sleep deprivation actually makes the situation worse. So that's kind of interesting. All right. I would be negligent not to bring up the whole issue of driving. So if you're sleep deprived, it's just like drinking alcohol. So don't drink and drive, don't drive sleepy is the analogy. So, and it's actually the crash risk based from the National Transportation Safety Bureau. The risk for, if you're sleeping 6 hours a night or less, your risk triples. So there's a great experiment we can do twice a year. We can do an experiment to see how sleep deprivation impacts our sleep. So this next table here looks at daylight savings time and crash risk. And this came out of Canada in '92. So in the spring, the Monday before the time change of the risk, and you can see that there's much higher risk of the sleep loss, and then that it reverses in the fall, okay? And so every year we can do this experiment at least twice, and it's pretty. And this is just an hour of sleep loss, and look at the difference in the crash rate. It's pretty big, more than you would expect. All right. So this is the slide looking at cognitive performance and comparing to alcohol, and they're very similar graphs in terms of, so you can almost think of sleep deprivation just as you would alcohol intoxication. It's the same idea. All right. So sleep deprivation and metabolism. So if you acutely sleep deprive somebody, so coming in on the night flight from Seattle, you're acutely sleep deprived because the plane was late, you're coming in at 2 rather than 11. And so initially the metabolism is increased. With chronic sleep deprivation, there's a decrease rate in metabolism. And part of that's driven by your endocrine system, or the hormones, right? So the primary ones that drive the changes in our metabolism, growth hormone, it's decreased in acute and chronic sleep deprivation. There's two very interesting kind of new hormones that have been new in the last 10, 15 years. One is called leptin, the other was ghrelin. These actually influence our appetites. So leptin is produced by your fat cells, your adipose tissues. And so leptin is what the body uses to tell everything else that you're full, you're satiated, you don't need to go foraging for more food. And so in the case of sleep deprivation, leptin is decreased. So it's artificially telling you that you need to go that you're hungry and your energy stores are low and you need to go foraging. Likewise, another similar hormone is released by the stomach. It's the one that actually tells you that you're full. And so in sleep deprivation, ghrelin is increased. So what happens with these two hormones, the increasing ghrelin and the decreasing leptin, that actually is driving your hunger when you're sleep deprived. And you typically will crave high carbohydrate foods, and your ability to tell when you're full is diminished. So this is why, for example, you come in on the night flight at 2 to 3 o'clock in the morning. It's just a couple hours. Sourdough's is up. Sourdough Sam's opens up at 6 or so. Decide to stay up and just go have a breakfast. So you go into Sourdough Sam's and you'll have the double order of stacked pancakes with lots of syrup, and you eat 3,500 calories worth of food. And you're like, this is great, I'm gonna go home. And then it's 10 o'clock in the morning, just a few hours just after you eat 3,000 calories worth of food, and you're starving. We've all had that experience. And that's because of these hormones, okay? Now imagine if you're the college student who's staying up 5.5 hours a night playing video games, or you're the shift worker at Fort Knox gold mine who's working night shift and you're only sleeping 5 hours a night. Those people really pack on the pounds. They're overeating somewhere between 800 and 1,200 calories a day because of sleep deprivation. So if you're thinking weight loss, you better be sleeping 7-8 hours a night, because otherwise the endocrine system is a force to be reckoned with. You won't be able to oppose it as effectively. All right? All right. Type 2 diabetes, for the same reasons. Yep. Yes, cortisol. So cortisol levels with chronic sleep deprivation are driven up. Cortisol levels, so sleep deprivation is a stressor and can drive cortisol levels high as an acute and chronic stress.
And can you remind us what cortisol is? It's bad?
Yeah, so sure. So chronic cortisol is one of the stress hormones. So if you get sick, acutely ill, or if you have an injury, the cortisol levels are the fight or flight. It's one of the fight or flight hormones, and it actually it helps you. It revs up your immune system. It actually prepares your body to fight. So it makes the use of glucose more efficient. And it prepares you to burn fat and glycogen for extra energy. So it's the hormones that kind of revs things up to prepare you for a fight or flight scenario. But in this case, it's not a fight or flight scenario, it's sleep deprivation that's driving it. Short-term cortisol elevations are probably not so bad. We do it all day, you know. We just got the tax bill in, and now we're stressed. Or we just read the paper. And you know, our cortisol levels go up. And so acutely, it's probably nothing. But long-term, chronic cortisol will drive, it'll increase weight gain and favor the development of diabetes and prediabetes. Is that helpful, hopefully? So this is, again, this is looking at type 2 diabetes risk. And you can see here, the lowest risk is for people sleeping 7 to 8 hours a day. So you might say, well, this is well and good, you Dr. Triplehorn, you talked about people who are sleep deprived. So that, of course, that makes sense to me here. What about these people here? I mean, they're sleeping more. How come the curve doesn't go this way, right? So the answer to that is, so very possibly these people have other disorders that are actually driving the curve this way. So the one I would tell you that would be most likely would be obstructive sleep apnea. So as you gain weight and develop type 2 diabetes, your risk for upper airway obstruction and type 2 and obstructive sleep apnea increases. And so so those people tend to sleep more, and it's probably driving that a little bit. So that's probably where you're seeing part of this curve coming up. All right. Gastrointestinal physiology. So our gastrointestinal symptoms do change physiologically as we sleep. There's a decrease in salivation, swallowing diminishes, the ability of the GI tract to actually push things along, or peristaltic action is decreased. The lower esophageal sphincter pressure, the sphincter here that actually is the top part of the bag that keeps the stomach acid in at night while you're laying down, actually gets looser a little bit when you're sleeping at nighttime. Whoops. And there is also an increase in stomach acid secretion between 10 and 2 a.m. And so out of this is that you can get an increased risk for GERD, or gastroesophageal reflux, at nighttime. And it turns out if you're not sleeping well for any reason, sleep apnea, insomnia, shift work, take your pick, your risk for clinically significant heartburn is increased 3 times. Okay? So this is a really common problem, and there's probably a number of people in this room that have this problem from time to time. So what I look for is if I have a family practice patient who I'm treating for heartburn at night, and they're saying, look, I've been on 2 medications, it's not working, and I don't know what to do. One of the things I go looking for is sleep deprivation or difficulty sleeping, because it can be the driver for this, for the reasons that we talked about. And the big thing here is the reason it happens is you get an accentuated decrease in esophageal peristalsis. And this sphincter gets looser, and so it's more likely that stomach acid sloshes up into the esophagus and actually causes a chemical burn. And so if we can get you caught up on your sleep, hopefully things will heal up, tighten up a little bit. Okay. Cardiovascular risk. Cardiovascular risk is actually increased with poor sleep. And it's a nuanced comment or a nuanced statement, because there are specific sleep disorders that will really seriously drive your risk for cardiovascular disease. Sleep deprivation is procoagulant. It actually increases our ability to form blood clots. So if you're in a situation where you're predisposed for coronary artery disease or a stroke, having a blood capacity to clot more easily will increase your risk for stroke. Okay. It also, sleep deprivation actually increases blood pressure substantially at nighttime. So especially in the case of obstructive sleep apnea. So sleep apnea will seriously drive your systolic blood pressure. And initially it'll just be at nighttime. So the only time we would catch it would be at night. But as with sleep apnea, as it develops to be a chronic problem, the blood pressure elevation from that will actually extend well into the daytime. And so that can be a reason for, why, doctor, did I start having trouble with high blood pressure now? So if you have sleep apnea, that could potentially drive it. The other thing is if you're having trouble controlling your blood pressure with 2, 3, 4 medications, it's just not getting a handle on the blood pressure. Sleep apnea would be a potential reason for this. Now, and the same thing's also true for stroke. Sleep deprivation also tends to drive any of the vascular problems. Here's another. So that same experiment, that kind of biannual experiment that we do with daylight savings time. So if you look at the morning after, the Monday morning, heart attacks, the morning following the spring daylight saving time, there's an increase in heart attacks going to the ERs in the United States by somewhere between 25 and 27%. All right? That's just 1 hour change. So think about this. In the fall, it's the reverse. There's somewhere, I think it's like closer to 21 to 23%, but it's definitely, it has to do with sleep deprivation, and it drives cardiovascular risk, all right? All right. So human immunity, this is one of the areas that's really catching a lot of people's eye now. Again, it has to do with our ability to see how sleep is impacting our health and impacting our risk for disease. So sleep loss definitely affects our immune system. And the three major areas has to do with antibody production. It tends to be decreased. Natural killer cell function decreases. And and remember I told you that sleep deprivation tends to be pro-inflammatory. So you actually get increased inflammatory cytokines, which actually increase your risk for endothelial dysfunction in the heart. And then also it increases plaque formation within the vessel walls. So coronary artery disease and cerebrovascular disease increases because of these inflammatory cytokines on the wall. Natural killer cells. So there is some increased risk for breast and prostate cancer. Okay, and the reason for this is, so as well as we all love to think we are, every single day our body is cranking out an abnormal cell of some type. And it has the potential to become a cancer cell. And fortunately for us, we have these natural killer cells that are surfing our bloodstream and the tissues or the lymphatic system between our cells. And they're looking for these abnormal cells and taking them out. And that's why all of us are not developing a lot of cancers. But when you're sleep deprived, it can potentially increase the risk for some cancers, at least at this point. And the ones that have been most closely associated are breast and prostate cancer. Okay? All right. Antibody production. So if you came in and got your flu shot, your response to the flu shot, like how well you actually responded and how well it protected you, actually depends on if you're sleep deprived or not. Because your response to the flu vaccine or any of the vaccines you get is diminished if you're sleep deprived. So I would say, like, if you've had trouble sleeping for the week or so before, or if you didn't sleep well the night that you were planning on getting, I would tell you, like, I would hold off on getting your shot, because the studies show that you actually get a better immune response after you've slept better for a few days. Right? So this is the response to influenza vaccine. This is the antibody titers, and the more sleep deprived you are, the less response you get. Your risk for developing the common cold, if you're sleep deprived, if you're sleeping less than 5 hours, your risk is increased to 45.2%. And then this is the baseline risk here, 17%. But pretty big increased risk. So you would wonder, like, for example, so those of us that fly out of state all the time, so we get on the plane here at midnight, we fly to wherever we're going, so we're sleep deprived, and then you're exposed to all those viruses in Seattle and Chicago and all these places. I mean, is that part of it? Is that why, like, when people come back to Fairbanks, people get sick? It seems that way. It would be an interesting idea, but anyway. Sleep deprivation, athletic performance. Sleep deprivation is, and human sleep is actually taking the interest of professional sports teams. Every professional sports team in the US right now has a cadre of sleep doctors working for them. Professional football, professional hockey, professional basketball is a multi-million-dollar industry. There is a lot weighing on what happens. Even some of the stars actually have their own personal sleep doctors. I'm friends with the Dr. Seisler, who's actually the personal sleep doctor for Shaquille O'Neal. But for Shaquille, he's a smart guy, and he's a very bright guy. I've never met him, but the stories I've heard. And so he takes a real personal interest in his performance and how it impacts his game. And so if he's not sleeping well, or if he doesn't plan a trip properly, it seriously impairs his ability to generate income. And so he takes it very seriously. Same doctor also is the sleep doctor for Mick Jagger. And so Mick Jagger now, in the other days, it was about playing the band, and it was about the scene. But nowadays, Mick Jagger is about the performance. He takes the performances that he does very, very seriously. And so this doctor I know, he is tasked with planning the band's tours like a year in advance, so that they're as rested as possible for the performances, right? So in terms of individual, sleep deprivation does decrease your cardiac output. It decreases your muscle memory and coordination. So if you're a soccer player, right, and you're learning how to kick the soccer ball a new way, and you're sleep deprived, so if you've been up playing video games or watching Netflix this summer, and rather than sleeping so you could actually do well in soccer camp, your ability to learn the new task or learn how to eat chopsticks with your left hand, that is definitely impaired if you're sleep deprived. Additionally, your decreased reaction time, your overall speed is decreased accuracy, your ability to use glucose or glycogen as fuel is diminished, and reduction in time to exhaustion, and the time that it takes you to recover after training or playing a game is significantly higher. All right. So I tried to find an example. So this is Andre Iguodala, who is with the Golden State Warriors, and so they actually they tried to compare how he did, game to game over a year, and this is his performance depending on what, sleeping better. So it actually seriously improved his points per minute, increases minutes of play, and if you think of this as a multi-million-dollar industry, these are not small numbers. And these players take it very seriously. One of our local hockey teams, they will not play a goalie if the goalie is thought to be sleep deprived. They won't, because his speed is reduced by 30%. It's a math problem, So risk for injury in athletes. Risk is much higher the more sleep deprived you are. So again, if you're a professional athlete, an injury could actually seriously impact your career. So being caught up on sleep actually decreases your risk for injury. Okay, Alzheimer's disease. This is a little bit of this is very new information. So this is a normal brain. This is somebody who has advanced Alzheimer's disease. And you can see that what you really want to look at is not the white areas here, but look at the gray area here and see how reduced it is there. That's the impact of what we're talking about. All right. So here is the really cool thing that's just been found. So in the last 8 years, there's a newly described pump in your brain called the lymphatic system. And it's really pretty interesting. So if you think of the brain cells, so these are neurons. Here's an artery. Here's a vein. And so these are neurons. And in between the neurons, there are these little cells, these little white cells called glial cells. They actually are like the jello for the brain. They actually provide the brain structure. They don't transmit signals. They provide structure. So it's the jello in which all the neurons sit. All right, so what happens is, in this pump, is that fluid sitting around the arteries here, actually the flow of fluid actually increases and actually can get cleaned out by the veins. So basically you're increasing the flow through the jello to kind of wash it out. It's like a washing machine, right? All right, the only time this happens is in stage 3 sleep. So, okay, This is the only time this happens. So let's take a look at this. So here's somebody, so this is looking at the fluid in between the jello. Here's around, this is an artery. And look, this green here is the fluid that's been markered. All right? And now we let the person fall asleep. And look how the fluid washes this stuff out. All right? So what you're washing out is really two kinds of protein. One is beta amyloid, and the other one is tau protein. And these are thought to be the two culprit proteins that actually cause us to have Alzheimer's disease. All right? So the tau proteins are actually in the neuron, and they actually form microtubules, and they actually clump together and decrease the nerve's ability to transmit. And then the beta amyloid actually clumps up in between the cells and kind of blocks things. All right? So if you look at, this is another functional scan of the brain. So here's looking at beta amyloid in a healthy person. And then if you look more carefully here, you can see it's actually increased in somebody with Alzheimer's. Even more dramatically, this is tau protein in a normal person. And look at the Alzheimer's side. That is dramatic. Okay? All right. So the association that's being explored right now is the association with sleep deprivation and sleep disorders and Alzheimer's disease. And that is a super hot topic right now. And so if you're not sleeping well, you could seriously be increasing your risk for either mild cognitive impairment, which is a very mild memory disorder that occurs as people age, or Alzheimer's disease. And you can actually, if you look at populations of people that are sleep deprived, so people who are working shift work, or doctors who are on call on the time, or people up at night for other reasons because they have other sleep disorders, it can seriously increase your risk for Alzheimer's disease. All right? So sleeping well has very much long-term sleeping well has long-term benefits that may be beyond what we thought. There's a guy out of UCLA right now called Dr. Bredesen, and he just published a book called The End of Alzheimer's. And so like all these guys doing researchers, they all want to come out with boutique clinics and write a book. But I think he's actually onto something. So he actually is looking at the potential for reversibility of Alzheimer's disease. And so he has the Bredesen protocol that's just come out. And it's a protocol that you kind of would expect. It's making sure you're sleeping normally, 7-8 hours nightly, and if there's an underlying sleep disorder, addressing that. He's having his patients exercise close to 90 minutes a day. Exercise is neuroprotective, very much neuroprotective. And then moving people to an anti-inflammatory diet, so significantly reduced dairy and animal products. He has case reports that you'll see in the book, and I've also seen lectures where he talks about reversibility. And so he gives one example of a university professor who was speaking 4 separate languages, and then as she developed her Alzheimer's, she lost the ability to teach and also speak these languages. And this is a lady that, this is somebody who had clinical diagnosis, was clinically diagnosed, and then also had PET scans that also kind of confirmed the possibility of Alzheimer's disease. And then he put her on this protocol, and according to the case report, she actually regained the ability to speak some of these languages. I don't know if she went back to teaching, but to regain the ability to speak 4 languages, that's fairly impressive. So I think he's on to something. I don't know if what he says in the book is entirely true. This is pretty new stuff. But the impact of sleep is what I find very interesting. And I really like this pump a lot because I think that there's a lot more. And it's interesting, these glial cells, so during the daytime, they're pretty robust, big cells. But they shrink down like 75% to make room for this amount of fluid. So they shrink only at nighttime, and then they puff up during the day and fill the space. And I think that's just incredible. Yeah. All right. So we've raised lots of questions and concerns probably at this point. So I want to talk about some strategies that actually improve sleep quantity and sleep quality. But before we do that, any questions?
It has to be 8 continuous hours of sleep, not 4, like from 8 o'clock at night till midnight, and then another time from 3 to 7 in the morning?
Yeah, so that's an interesting question. So it depends on what you're looking at, what metric you're looking at. But you're referring to Alzheimer's? So, yeah, so the brain, in terms of the 7 and 9 hour requirement, that's in a 24-hour period. Now, there's lots of ways to skin a cat. And so you can get all of that continuously in one fell swoop, like most of us do. Or there's some people that actually will get it in pieces and parts, like 3 hours here, 4 hours there. And in aggregate, it adds up to 7 to 9 hours in a 24-hour period. When they've actually looked, so in terms of Alzheimer's disease and specific disease-related issues, I don't think we really know. But what we do know in terms of cognitive performance and some of those kind of metrics, clearly the more continuous sleep is better than broken sleep. And yeah, so that's, in fact, there's a great movie out called, I'll think of it in a minute. Speaking of memory, the Rowing to Extremes. And it's about a young woman who lives in London, and she decides that she's in her 30s, and she decides, golly, I am just like a cubicle worker, and where's my life going, and what do I have any meaning? And so she decides to do something challenging. So she decides she's going to row across the Atlantic, and so she raises money and trains, and one of her sponsors was the DoD, and so the part of the experiment was that she was going to sleep 4 hours, be awake for 4 hours, sleep 4 hours, and do it for an X amount of time. And then she was going to do the psychomotor vigilance testing, and they were going to actually measure, like, were you able to stay awake? Were you able to complete these tasks, and how accurate were you? And so they had to discontinue it pretty quickly because just 4 hours on, 4 hours off, her performance just rapidly eroded, and she was making pretty gross errors in terms of navigation and just unsafe behavior. So they basically bailed. But interesting story. But in terms of answering your question, yes, yeah.
Okay, so how do you talk about athletes, or how do they test them quickly for? They don't know that they're sleep deprived, but they have to. The doctor has to figure it out.
So we have ways of doing that. So obviously, I mean, the best way to engage people is to talk to them, and so ask them about their sleep history and that. And there's cues we look for in terms of that might represent disordered sleep. So one of them might be, how easy do you find it to nap during the day? And if somebody says, I can nap, but it's difficult. I have a hard time, as opposed to somebody that says, I could nap anytime. I mean, I don't nap because I'm working, but if I had the opportunity, I could nap anywhere. That's a red clue. So there's historical pieces that we could look for in someone's story that might suggest an underlying sleep disorder, that might prompt us to look. But let's say we'll take an older person that can't tell me, or a child, who they'll talk to me about giraffes and elephants, and I'll never get to how they're sleeping, and so I actually have ways to tell. So we have ActiWatches. So it's a high-tech Fitbit that's actually powered to actually look at sleep. And I can actually look at sleep timing, duration, continuity. Are they napping? Are they not? Is the sleep disrupted at night? I can kind of get a sense for what that's about. And then, so that's looking at a macro scale. So I can look at 2, 3, 4 weeks and actually get patterns from that. And then if I want to look on a nightly basis, I can do an overnight polysomnogram. So I can actually look at the non-REM, REM cycles and what's going on. And how's it changing? Is there sleep apnea? Is there periodic limb movements? Are there nocturnal seizures? And I can actually see all that and see what's disrupting sleep.
And that's like a sleep study?
Yes. Yeah. The kind of sleep study depends on what we're looking for. But I've got to tell you, the athletes, I've encountered a number of the Naminooks and a couple of the Seawolves. Some of these guys that are pretty hard set on being professional hockey players. And these guys are pretty serious. And so you start asking about sleep, and before you know it, they're asking you questions. Well, what about this and what about that? Because they're very much aware of things that actually impact their performance. They're motivated. They're not going to let the opportunity pass, if there's something they can do about it. All right, so sleep strategies. So the difference between strategy and tactics, okay? Strategy, I would like to sleep better and be healthy, okay? Tactics, how are you going to do that, okay? There's a difference, all right? So what I'm going to tell you are evidence-based tactics that you can actually start to employ to actually try to improve the quality of the sleep. There's no magic bullet here. There's nothing magic, I'm telling you. And it's not likely that any one of these tactics is actually going to get you to where you want to go. It will be a combination of things. You're going to have to try them out and see how it fits your lifestyle and you as an individual. All right? All right. So, most important thing in my book is this: consistent bedtime routine and sleep schedule. All right? And this seems pretty obvious and pretty benign, but it's really underappreciated in our culture and our society. You would not believe the sleep habits and sleep schedules of people. It has a very low priority for many people, and it's all over the map. But that is not how your brain has evolved. If you look at animal species, primates, the various kinds of hominids, all of those species actually obtain adequate sleep. It is Homo sapiens, we're the only species that decides to become sleep deprived by choice. Very few examples in nature where that happens, all right? So our brains are evolved for adequate sleep. But as human beings, we're very, very susceptible to classical conditioning, okay? Classical conditioning is there's a certain series of cues, and that produces a certain kind of behavior, all right? So here's a classic example of classical conditioning. If I talk to you about Christmas and, what does Christmas look like? And I talk to you about gingerbread and Christmas tree smells, that for most of us, that elicits warm memories, kind of a relaxed sensation. We feel all warm inside. So that elicits a response. You're conditioned to have that response, okay? The same thing's true for sleep. If you have the same pre-bedtime sleep routine and behavior, you're conditioning yourself to fall asleep at a certain time. So the more routine it is, the better you will do. Our brains are set up to pick up patterns, and this is a pattern that would work, all right? So adequate time every night, 7 to 9 hours nightly, consistent. I really like the idea of bedtime routine. So, at 9 o'clock, it's time for some nice light jazz, turn off the digital media, get out the book, listen to it for a while, take a shower, get ready for bed. This nice routine that you do every single night at the same time. And that very quickly will start to help improve your sleep quality. And I know this is true because there was a study that was in the New York Times, or published in the New York Times recently. They took a whole bunch of people that had self-proclaimed insomnia of various kinds, and they took them camping in Estes Park, believe it or not. And they rented cabins, but there was no artificial lighting, no digital media. And uniformly, in the 100+ people that were studied, at the end of 2 weeks, most of them were falling asleep between 9 and 9:30, and they were getting up at 6, somewhere between 6 and 7, pretty uniformly. And it has to do with how our bodies respond to the light, how we're responding to digital media and artificial lighting. And so what it tells me is that in the right circumstances, the right routines, we can actually improve our sleep quality. And it's classical conditioning. All right? So avoid excessive napping. So the trick with napping. So napping is a problem if you find that you need to take a nap every day. If you're sleeping normally, it should be a little difficult for you to nap every day. And you should typically not find yourself unintentionally dozing, okay? Now, there is a period of time in the mid portion of the day where we will get a little drowsy, and that's because there's a mid-afternoon drop in our body temperatures that drives drowsiness. That's normal. and it could lead to a brief nap, but you shouldn't find yourself wanting to nap or doze at other times during the day, all right? So this whole thing is like, should I nap or shouldn't I nap, and what do I do? And so there are really great studies that actually look at naps and human performance. So if you're like really into like performing well at a high cognitive level or physically, a nap could actually really help you. So a nap that's healthy is less than 30 minutes prior to 4 p.m. All right? And that can improve performance without impacting the night's sleep. If you find you're needing to nap at other times, that's not normal, and that should be pursued medically. All right? Okay. Avoiding digital media 1.5 to 2 hours prior to bedtime. This disrupts the circadian timing of our sleep, okay? And it's the high-intensity blue spectrum lights that comes off these screens, off our iPads, off our smartphones. So 7 minutes with a smartphone will actually delay your ability to fall asleep by 45 minutes. A half hour on your computer or watching television or on your smart pad, that can be as much as 2 hours. It can delay your ability to fall asleep, okay? All right. All right. So one way to address that, there's 2 ways. So if you have to be on the computer, like you just can't let it go. Many of the new devices have a night shift application that can be helpful. It turns the screen a pumpkin color, kind of like this guy's shirt right here. It'll turn it a pumpkin color, and that'll actually block, to some degree, the blue spectrum light that will keep you up. And then if you don't have that, you can actually buy blue blocker sunglasses on Amazon. So if you wear glasses, there's over glasses. If you don't wear glasses, there's regular sunglasses. And you could put those on while watching the television. Yeah, okay. Temperature, so temperature cooler is better, all right? So the thing that triggers your falling asleep at night is a drop in your body temperature. The maximum body temperature is in the late evening. And so typically 8, 9, 10. And it's the drop in the body temperature that actually causes drowsiness, okay? So, and it's the differential, it's the change that actually drives the sleep, all right? So you know this is true if you've been in Fairbanks for a long time because you've been at the hot springs. So it's a winter day, you thought it'd be nice to drive out to the hot springs, you have a nice hot spring, you get in the 20 below car, and you're driving back to Fairbanks. Exactly. So if you look at Chena Hot Springs Road, about 10 minutes to 15 minutes out, you'll see all these skid marks. And I kid you not, I am sure that what's happening is people are getting drowsy. So you can take advantage of this. So if you're in a warm bedroom, make the bedroom cooler so you've got a bigger differential. If it's hot out at night, and what you do is you take a quick shower and let the evaporation cool your body temperature. You can use this as a tool to actually help yourself sleep. Okay? Avoiding caffeinated products. So here's with the adenosine. So remember I told you adenosine actually triggers the cascade of events that allows you to fall asleep. Guess what? Caffeine is an adenosine blocker. Okay? It blocks the receptor site that actually allows adenosine to do its work. All right? And its half-life is pretty long. So it can be as little as 2.5 to, this says 4.5 hours, but it can be as much as 6 hours. So the typical recommendation, if you're planning on sleeping well, is avoiding caffeine 6 to 8 hours out. Now, there is significant variability in terms of how each of us responds to caffeine. If I walk into the coffee roaster and walk out, I've been exposed to enough caffeine to keep me up for days. And just being aware of how you respond to caffeine is important. So rules are rules, they're meant to be bent and broken. So if you're somebody who doesn't respond to caffeine, ignore what I told you. If you're somebody who does, be aware of the half-life and how it potentially may be impacting. Responsible use of alcohol. All right. So alcohol, seriously, so if you're having trouble sleeping, I would think about your use of alcohol. Because alcohol can definitely allow you to fall asleep in a shorter period of time. But it... You're good to go. Thank you. Yeah. So it very much can fragment your sleep. So typically what will happen is somebody will have a glass of alcohol, and they'll fall asleep, and then usually about 3 or 4 o'clock in the morning, the sleep gets lighter and more easily fragmented, and they're aware of, they start having trouble with insomnia. And that's pretty classic. So in my case, the first time I noticed this effect was with some kinds of aged sake. And I like sake, but the reason I don't drink a lot of it is because it causes, for me, it causes horrible insomnia. And then what I've noticed as I've gotten older is that usually more than a glass of anything past 9 o'clock, and I can almost count on waking up at 3, 4 o'clock in the morning. And it has to do with how the alcohol is metabolized, okay? The other thing with alcohol that's really important to realize is it diminishes your response to low oxygen and CO2 levels. So if you're somebody who has COPD or a lung condition, your ability to respond appropriately to a low oxygen level or high CO2 level is going to be impaired. So these are where people will fall asleep and go for the big sleep, all right? And that's why alcohol is dangerous in patients with severe sleep apnea or some lung conditions. And likewise, alcohol can worsen obstructive sleep apnea. It relaxes the airway more and actually can make the sleep apnea worse. All right, so here's the impact of alcohol on sleep. So the black line is a normal, we talked about the 4 cycles. You can see this, the black line here looks pretty good. And then here's the impact of alcohol. So it really puts you down into stage 3 sleep here, and then there's a lot of extra REM here. But what you don't see here is for both of these times, the sleep is very fragmented. This person is waking up several times per hour, and it very much fragments sleep. Yeah. And then obviously this is a graph looking at how much you're drinking and the degree of the quality of sleep. And you don't need me to tell you that obviously more is worse. All right. So here's an interesting thing. So meal timing and snacking. So this has to do with circadian timing of eating and how does it impact your sleep. Because you can use this as a dieting trick, and it's very, very effective. And this is actually kind of new. So, there's something we all have called insulin, and it allows us to use blood sugar. Glucose cannot enter your cells in the absence of insulin. You have to have insulin molecules to partner with the glucose to get into the cell. It just doesn't happen, right? So your insulin, there's something called insulin resistance. So it has to do with how well the glucose pairs with the insulin and gets into the cells. So in a low insulin resistance environment, that pairing happens pretty easily, okay? In a high insulin resistance situation, it takes more insulin to get one glucose molecule into the cells. So that's called insulin resistance. So insulin resistance is lowest in the daytime and starts to increase after 4 p.m. in those of us that are conventionally sleeping. So that means if you eat an apple during the day, apple goes in, gets turned to blood sugar, and gets burned as fuel. At nighttime, after 4 p.m., eat an apple, blood sugar goes in, now it has a lot of trouble getting into the cell, and now it gets diverted to become fat. So a dieting strategy, but also a better sleep strategy, would be to front load your calories. So eat 85 to 90% of your calories before 4 or 5 p.m. and really minimal calories after that. And that's taking advantage of the insulin resistance. Now the interesting thing is that also parallels with an improvement in sleep quality. The more calories you eat after 4 or 5 o'clock, the worse your sleep will be. So this is sleep latency. This is how long it takes to fall asleep. There are other measures as well, but the sleep latency was the most dramatic. So the more calories you eat, the worse your sleep quality be. So if you're having trouble sleeping or you're interested in dieting, then preloading your day could actually be of help. Now, one word of warning, if you're somebody on insulin, you should talk to whoever your primary care doctor is if you're thinking of preloading because it makes a difference in how insulin is administered. So just before you do that. But it can actually change sleep quality. Okay. Same thing, sleep efficiency. The more calories you eat in the early evening, the lower the sleep efficiency. All right. Vitamin D. So vitamin D deficiency can actually impact sleep quality. It impairs wakefulness, so you tend to be more drowsy during the day. It actually increases your risk for sleep apnea. So it causes tonsillar hypertrophy, so the tonsils will actually be a little bit larger in a vitamin D deficient state. The muscles of the airway are not quite as functional as they could be in a vitamin D deficient state, so the potential for airway collapse is greater. And for the same reason, it can worsen sleep disorder breathing. And I'm sorry, it can also cause chronic rhinitis, so it can cause airway obstruction. So the complex of having trouble breathing through your nose, larger tonsils, and an impaired muscular system in the airway can actually worsen sleep apnea. So I'm now starting to check my sleep apnea patients for vitamin D deficiency. Physical inactivity and exercise. Exercise is one of the few things you can do that will substantially improve sleep quality. I'm going to define that. So exercise is 60 to 90 minutes of almost anything will actually improve sleep quality, and that's especially true in women. Women, for some reason, really respond, with respect to sleep quality, respond very, very well to exercise. There's a little bit of a caveat that, so significant physical exertion prior to bedtime, so think about it, you're exercising, you're increasing your core body temperature, so you potentially could cause sleep fragmentation, not because of the exercise, but because you heated up your body, and it's the temperature thing that we just talked about. So you just have to be aware that that could happen. But exercise can substantially improve sleep quality. In terms of manipulating your circadian rhythm, I use this a lot here in Alaska because it's my belief that the midnight sun and the darkness in the winter seriously causes a lot of sleep trouble in Alaska. I see it clinically. And it's not just the extremes, it's the in-between. Because every day, the light is either getting more or less. And not by small amounts. It's 7 to 9 minutes or something like that. And so what that impairs is our circadian timing. So your pineal gland in the middle of your brain actually produces a product called melatonin. And it is inhibited when you're exposed to sunlight. So melatonin is not released if you're exposed to full spectrum light or some kinds of artificial lighting, all right? So, and it's the melatonin release that actually causes healthy sleep onset. So your body is actually primed to respond to two stimuli that actually influence your circadian rhythms. One is melatonin, which is this curve here. And the other thing that influences is our circadian rhythms is light exposure, which is here, okay? So, if you take melatonin, so this is called a phase response curve. So if I give them a dose of melatonin at, this is 1800 or 6 o'clock, that is going to maximally influence the sleep onset. So if you're going to take melatonin, you want to take it, so this is assuming somebody's normal bedtime is here, right? So about 9:10. So if you take your melatonin at the maximum time of this curve, somewhere between 3 and 6 p.m., then it's going to move your bedtime earlier. So this time of year, when the light is pushing our bedtimes away from us or later, you can counter that with nighttime melatonin, 6, 7 o'clock. And it'll pull that bedtime earlier and keep it from driving late, okay? Likewise, if you expose yourself to morning light exposure in the morning when you get up, like right in this area here, so 6, 7 o'clock in the morning, if you expose yourself to light in the morning right here, that'll also pull your bedtime earlier. So the big problem we have here in Alaska is our bedtime is being pushed late, especially in the spring, summer, and fall because of the light exposure. So to counter that, so morning light exposure can be very helpful, and then evening melatonin exposure, okay? So what I do is I have my patients, because of all the changes with our and our lighting up here, I try to stabilize the signaling to our circadian systems. I have my patients pick up something called a Philips wake-up light, which is it's about yay big, and it mimics a sunrise, and they're awesome. And so basically, even while it tends to start up about 30 minutes before you wake up, and the light mimics a sunrise, and you actually get exposed to full spectrum light. So even though your eyelids are closed, the 460 to 480 nanometer light does penetrate the eyes, and does start the waking up process, and it actually sets the circadian time. It actually stabilizes your circadian rhythms. Okay, if you want, go ahead. Yeah, question? No. All right. And then if you want to enhance that even further, you use the light, get a full spectrum light for your desk and use it in the mornings. So the full spectrum light alarm clock in the morning and then bright light in the mornings can be very helpful. Likewise, you can use melatonin in the evening. And again, you want to time it, I would say 6, 7 o'clock. If you're planning on going to bed like 9, 10, I usually time my melatonin like 6, 7 o'clock to take advantage of this phase response curve. And the dosing matters. So you actually get the lower the dosing, the better the response. So I usually, and so this has 3 milligrams and 5 milligrams. The best dose actually is going to be somewhere between 2 and 3 milligrams for adults. Okay. All right, anybody have questions?
So basically, you want to take it like 3 hours before you go.
Yeah, 3 to 4 hours, yeah. Because normally melatonin is secreted by our brains about 2 hours prior to our falling asleep. And that's, like I said, it's the starting gun that actually starts the whole process of falling asleep. So that normally starts about 2 hours. If you want to move your clock earlier, then you take it around 6 or so, and that actually can be very beneficial, yeah. And the formulation of melatonin doesn't matter. I would go cheap and go low dose. The higher doses are not more effective. You're just making more expensive urine, okay? And it doesn't. And actually, the higher doses are not as effective. So the lower doses tend to be a little bit more effective. Yep.
So if you take the pill at, say, 6 o'clock, then it will have digested and got worked into your bloodstream.
Yeah, because what you're trying to do is cause an artificial spike in the melatonin level, so the body thinks, oh, it's bedtime, and so it starts the cascade of events that allows you to fall asleep. Now, I've told you enough that what is the pitfall if you're taking melatonin to sleep? What would you think? I already told you what it was. So blue spectrum or full spectrum light very effectively blocks the impact of melatonin. So you can have been really great, took your melatonin at 6, and then turned on Netflix and watched 2 episodes of MASH, and you're done, right? Oh, yeah, one's okay. So anyway, so the timing is really important, all right? Now,
Water, drinking water. I mean, you were talking about how does that affect your sleep?
yes, so dehydration, so if you are dehydrated, it can impact sleep. So obviously, if you're overhydrated, that can impact sleep as well. So therein lies the balance, right? So, but there are studies. There was a great article on hydration and work and physical performance. So it was NPR, I want to say about a month and a half ago. And they talked about how it impacts. I mean, just being slightly dehydrated really changes our physical performance and our cognitive performance. It's amazing. And so you're right, yeah.
Is there anyone who should not take melatonin?
That was my next point. Yes. All right. So people who should not take melatonin are people who are on anticoagulant or blood thinner types of drugs. If you're not sure, you should be checking with your doctor. The other people that this could, so melatonin can also affect fertility for males and females. So if you're planning on becoming pregnant or hoping to become pregnant, then it can affect fertility rates. And there are some other medications that can actually interfere with. The other thing is, so for me, the thing I go watching for are blood thinners and anticoagulants, because those are the ones that actually, that's where the serious side effects occur. And then, and melatonin does have a sedative property to it. And so obviously people are aware of that. The sedative property of melatonin lasts about 45 minutes. And that's it. But that's not its biggest bang for the buck. The biggest bang for your buck for melatonin is using it to manage your circadian rhythms. That's where the money is, okay?
Is there a substitute if you can't take melatonin?
Yes. So it would depend on the reason why. but there is a prescription-only formulation called Ramalteon, the other name for it is Rosarum, and so I use that in some cases, but it's a melatonin agonist. It's not melatonin, but it's a melatonin agonist. I also use that in adults that have trouble with breathing disorders because it doesn't suppress respirations and it doesn't impair swallowing or a response to oxygen levels. So I use it for those reasons. But yes, but I'd have to think about, like, so if somebody said, oh, I can't take melatonin, I'd need to know a little bit more about the why of that to decide whether we should try Ramalteon or not. Yeah. So we have to think about that. Yeah.
That's that lamp, that Philips.
Yeah.
What's the name of it again?
Philips Wake Up Light. Yeah, with sunrise simulation. So in full disclaimer, I don't have any disclosures. I don't have any ownership in Philips Respironics. Yeah. No. But excellent question. I have contributed to Amazon, though.
I have 2 bottles of melatonin, 5 milligrams. One says quickly, easy dissolve, and the other one says time release.
Right.
It's harder, is it?
Yeah, so the time release is what they're trying to take. They're trying to use the sedative property of melatonin to help you fall asleep. But remember, it's not a very potent sedative. Okay, it's not. So that's the time release thing, and it's supposed to catch your attention. You're supposed to buy it. But if you think about how melatonin works in our bodies and how it stimulates sleep, it's that sudden pulse that actually fires the starting gun that gets that cascade going so you fall asleep. So I would take the short-acting melatonin. And
take that at 6.
yeah, that's the one you want to take earlier.
It always says take 30 minutes before.
Yeah, they weren't sleep doctors who wrote for it.
So then take it back down to the kitchen instead of back.
Right, exactly. Yeah, no, exactly right. Yeah, all right. All right, we got to go right way here. We're almost done, we're good. All right, so here's a fun question. So what about sleep aids? 4% of the US population is taking sleep aids in the last month. The use is increasing greatly, okay? And this is not, and part of it's marketing. $41 billion in 2015. That's how much the Americans spent on sleep aids in this country, both prescribed and over the counter. And there is a lot of marketing involved. You can't sleep better without your Ambien. And if you don't have a prescription, there's a problem. So, all right. And it's actually increasing as you get older. So 7%, so 6 to 7% over age 50 are using a sleep aid. More commonly done in women, and more commonly done in patients who are well educated. All right, and there's lots of them. Ambien, Lunesta, these are the prescription ones that are most commonly prescribed. There are also some over-the-counter ones as well. And then there's some herbal products. In terms of herbal products, there's nice data looking at chamomile. Chamomile is relatively safe. It actually is a benzodiazepine. Benzodiazepine is like Valium. And it's in the flower. So if you buy your chamomile tea at Fred Meyer's in a sleepy time tea, you'll notice that there's no flowers in the little bag. It's lots of leaves and sticks. But if you go over to Sipping Streams, I have no ownership in Sipping Streams. There's lots of flowers, and it actually does have a nice benzodiazepine effect, and actually can be relaxing. So it has a little bit of an anxiolytic and a little bit of a sleep. And I'm not aware where it really impacts medications. But if you're on medications where there's a question, you should talk to your doctor and make sure. The herbal products. Valerian root, there's some studies that actually look, I've used valerian root for brief periods of time. I think it does work a little bit. I think its most off-putting part is its taste and smell. It smells like socks, or chewing on the forest floor, and it's not good. But it did work, and it does interact with some medications. The one I would have you really watch is kava kava. Kava kava has been associated with liver failure. And I saw in the market you could still buy it over the counter, which is kind of surprising. Yeah?
Have you any experience with theanine?
Theanine, yes. There is some data looking at theanine. And it does help sleep. It also helps concentration. There's some theanine. So they'll actually use it as a medication substitute for kids with ADD. But I've not seen a ton of sleep data. like head-to-head randomized controlled trials.
Can you spell that?
Theanine. Theanine.
Theanine.
Yeah.
What is it?
We'll spell it for you in a minute. All right. The other ones I want to tell you about that I'm really opposed to is the use of these over-the-counter products. So they all have first-generation antihistamines. And in people over the age of 60 to 65, they are specifically contraindicated for two reasons. One is they can affect the heart and heart rhythm. The other thing is that they oppose acetylcholine. And acetylcholine is one of the critical neurotransmitters that's in charge of judgment and memory. And so what we will have is you'll have a decline in memory and in good judgment. So this is pretty common, and people are using it commonly because they think it's over the counter, and it's the first generation antihistamine that's a problem. So I get all my patients off this because it's not good. Yeah.
For Tylenol PM and ibuprofen PM, is that significantly different than regular Tylenol or ibuprofen?
So in terms of the base ingredient of ibuprofen or Tylenol, I'm not aware of any difference in those products. The product I'm concerned about is the diphenhydramine primarily, or the dicyclamine as well. And that because of the acetylcholine. And so I would say in our hospital, like once every or twice every 6 months, we're admitting an older person to the hospital. And I would say older, 65 older, who's acutely confused because of a single dose of NyQuil Tylenol PM or something like that. Now, here's the other kicker for males. If you're a male and you have a prostate trouble, you could take a single dose of Tylenol PM and suddenly find yourself unable to urinate, all right? And you could have been taking it for many years and then like, oh my God, what's going on? And so the treatment for that is a catheter being placed for about 2 weeks. And it can be a real problem. I imagine if you were out in Valdez Harbor, it's a long boat ride. Do you know? And it's pretty it's common. So I really don't like these. But the larger question is, how effective are sleep aids anyway? All right. And I had to look hard for this because there's so much marketing in sleep aids. I mean, it's unbelievable. So to find randomized controlled trials. So this is actually the best I could find. This is a study from 2012, and it was looking at non-benzodiazepine hypnotics. So this is like your Ambien and your Lunesta and your Sonata, all right? And it turns out that these medications really improve your ability to fall asleep somewhere between around 22 to 40 minutes. That's the benefit, all right? And so slight improvements in subjective and polysomnographic sleep latency, somewhere in the order of 20 to 40 minutes, regardless of the type of drug. And here's the key thing. Although the drug effect and placebo response were rather small and of questionable clinical significance, the two together produced a radically large clinical response, which means that a large part of the response from any of the prescription sleep aids is placebo effect. All right? These medications are not without risk, all right? They can cause all sorts of weird behaviors at night. Sleepwalking, sleep talking, sleep driving, sleep eating. People get up and clean out the fridge. And I'm not joking. We have a video of somebody eating a bucket of lard with a spoon. Then a family member took it. And not very causes morning sedation and hangovers. Increases risk for falls and hip flexors. A lot of these can cause delirium. A lot of them can cause short-term memory impairment, at least the next day and the day after that. There's some animal data looking at memory, long-term memory in patients who chronically use Ambien and Lunesta on a nightly basis. It can cause urinary retention of males. That's the over-the-counter sleep aids we talked about. It can worsen your sleep apnea. It really makes the impact of alcohol and other sedating medications worse. There is a dependence, possibly addiction potential. Actually, Ambien and Lunesta and those medications are being sold as street drugs at a fairly high rate in Asia right now. Yep. And the rebound insomnia, so let's say you're taking this medication, like, I don't like this, I'd like to stop this medication. Dr. Triplehorn said it was a good idea. So you stop it. The rebound insomnia is intense. And that's with all of these. All right? Here's another fun fact. All right? So these are people that are using hypnotics. And look at mortality. So these are people at the top that are using either none or very infrequent hypnotics. And look at the mortality in people that are taking them regularly, especially based on age. So there is an increased mortality in patients that are taking these sleep aids on a nightly basis. And we don't always understand why. So in my mind, the medications provide marginal benefit, and there's quite a few adverse effects with other medications, as well as the adverse effects from themselves. And there's this increase in mortality. And I just, I know people take them. It's not that I don't prescribe them, I really do. But I try to be very targeted, and if I can, short term. All right, what about travel? All right, so if you live in Fairbanks, this is a really nifty website. Put this in your phones. Jet lag rooster, right? So in my example here, somebody going from Fairbanks to St. Paul. You put the dates in. You put if you want the recommendations to shift your sleep schedule, you can get it after you arrive, after you're departing the plane, or 3 days before. You hit the go button, and it gives you these nice recommendations on what you can do, how to use melatonin, how to avoid light. There's another. Yep, pretty nice. And for Fairbanks, this is a pretty nifty little website. So when the Nanooks consult me for what they're going to do for a travel schedule, I go to jetlagrooster.com. All right? And if my web server is not working properly, then I also use Entrain with University of Michigan. Yeah. All right. So when to get help? So, honestly, if you're having trouble sleeping, put a time frame on it. Try some things, do some reading, talk to some people, read the book. And if it's not working out to get you where you want to go, come talk to somebody. Now, it doesn't have to be me. There's another sleep doctor in town who's very good. We're friends. We're both plenty busy. We'd love to help you. But talk to somebody. If you're not getting where you need to go, help somebody out. Some specific things to look for, though. Again, persistent daytime sleepiness despite adequate sleep time. If you're sleepy during the day and it's easy to fall asleep, and you've tried to figure it out but can't, or then please come see somebody, because it can be something pretty serious like sleep apnea or something like that. Sleep apnea sometimes is associated with snoring, but not always. So the key symptom I go looking for here is that persistent insomnia is something we go hunting for.
Other than not being able to, or being sleepy, is sleep apnea a possibility without knowing you have it?
Yes. Yeah. So part of it has to do with how well we perceive how we're sleeping. And so there's a number of fairly robust studies looking at the subjective experience of how we sleep. And it has to do with how our brains work. And so I'll just, rather than focusing on sleep, in terms of how our brains work, our ability to remember things and process information while we're very sleepy or asleep is not very good and laden with errors. Classic example. You're at home, you're sleeping, bam, there's a big noise outside. You look out the door and there's a car wreck. And the driver of one of the cars was injured in some fashion. And you go out and try to help, but you're very tired. And if we were to interview you, like what were the series of events, what were the specifics and that kind of thing, your ability to accurately report what actually happened would be fraught with errors. And your brain would try to fill in the gaps. That's part of what our brains do. So if there's lots of data and we're not really sure, our brains will try to fill in the pieces so it makes sense. So we can tell a story. Now whether the stories are accurate or not is up for debate. The same thing's true with our sleep in terms of how we experience sleep. So human beings tend to overrepresent how badly they sleep or how well they're sleeping. Our ability to perceive how well or how badly we're sleeping is awful. And so that's why I use the actigraphy devices. That's why I use the in-lab sleep lab, in-lab polysomnography studies, because it basically breaks the tie. And it's not that the person's being dishonest or untruthful or anything like that. It's a factor for all of us as human beings. When we're sleep deprived, or we're very sleepy, or we're wakened from sleep, our ability to report accurately events that we're involved in or our experiences is very much laden with error. Yeah.
Can you comment on the symptom of waking up tired?
Yeah. So that's called sleep inertia. So we'll actually give it a name. So sleep inertia is the experience of waking up and just feeling like I just want to go back to sleep. And that's called sleep inertia. So that can represent two things. One is it could be circadian timing. So this person might be a night owl, so they're going to bed at 2 or 3 o'clock in the morning, and they normally would wake up at midnight, but we woke them up today at 8 o'clock. So it's just the middle of their night. So of course they're going to have sleep inertia, right? Because I just woke you up in the middle of your night. The other thing is that sleep inertia could represent is sleep deprivation. So this is somebody who slept 7 hours a night, but they're still tired, they're still exhausted, and they can easily fall back to sleep or sleep in. Or they're sleeping in, they're actually sleeping 10 hours a night, 11 hours a night, as opposed to 7 to 8. They're amount of sleep. So that's sleep inertia. Yeah, so in that case, I would go, so my comment would be, I would wonder, is it circadian timing problem? I would wonder, is it an effective medication, perhaps? Is there another primary sleep disorder? Sleep apnea, periodic sleep disorder, nocturnal seizures, something like that. So that's how I would think about that. Yeah.
So you talked about reducing your calories after 4 p.m., but that would be like for someone who's like on a day shift. What about if you work, like you start work at 3?
Yeah, you have to alter it depending on the shift, and we have to look at the time like over a month. Like what is the overall sleep schedule? So that's an excellent question, because the circadian timing is going to be messed up because of the shift work. And so we could decide that doing anything with respect to timing of meals probably wouldn't be a good idea. That the overall strategy at that point, would be to just make sure you're getting 7 to 8 hours of sleep. Because the timing of the meals, it might mess things up. So, yeah. And this is still new in terms of timing meals. And there's a book that just came out, and some of the literature with respect to how you time your meals for dieting. All of this is relatively new with respect to insulin resistance. And again, it also depends what medications you're taking. All right, more questions? So we'll move left to right. Go ahead.
What do you think of the tactic, the new one, the weighted blankets?
Oh, yeah. So, what was it? What is it? The tactic of using a weighted blanket? Yeah. So there's no data. I looked, I've tried one. I actually, I'm a bigger guy actually, and I bought a 35 pound weight. Little good, more might be better. So I think it helped a little bit after a while. I found it annoying because I couldn't turn over. But I have family members and patients that swear by them. So this will be one of those things like it's a personal experience thing. Some people really like them, but I would not suggest it heavier. Yes.
How good are things like Fitbits in terms of giving you a measure of?
Yeah, so Fitbits, the Garmin watches, so they're pretty good at giving the boundaries of sleep. So when you fell asleep and when you woke up. The stuff that happens in between on the Garmin's and Fitbits is suspect. They're just not powered to do what my Apple Watches do. Now, I will tell you in a very short period of time, like if you buy the next 1 or 2 Garmin's or these watches are going to be pretty good. They're not going to happen. But they're nice for using the bumpers. So I do look at the data if the patients have it, but what I'm looking for is when they fell asleep and when they woke up. And the rest of the stuff, like you're in REM sleep. I mean, it's not using an EEG, how would it know? So, yeah.
Thank you.
So looks like we're good. Any questions? Middle section.
You talked about dreaming on the radio, and so I'm a little wondering about that. I'm a prolific dreamer, and often right before I wake up in the morning.
Yes.
Is this common?
Yes. So in terms of numbers, so dreaming. So 80% of our dreaming occurs in REM sleep, 20% occurs in non-REM sleep. The non-REM dreaming is typically the dreaming that you're not going to be aware of. And the reason is it typically occurs early in the night. This non-REM sleep occurs in the first 2/3 of the night. And the thing about REM-related dreaming is they tend to be bizarre dreams with all sorts of weird patterns to them, and there's a very strong emotional attachment to the kinds of dreams, and so they tend to lodge in our memories a little bit more. Now, so when people talk to me about dreaming, so some people so part of the bell curve would be people that are just heavy dreamers and have high REM density and are just very active dreamers. But you would wonder, is there something going on that might be setting you up for active dreams? So anything that would sleep deprive you, where you would be REM deprived, and so in somebody who's sleep deprived for any reason, they're looking to catch up on REM, and when you're catching up on REM, the dreams tend to be more active and more emotionally involved and more bizarre. There are also some medications that cause pretty wild dreams, and the commonly used one is a blood pressure medication or heart medication, the beta blocker class. Those commonly cause odd dreams. Most times people push their own, but occasionally in my experience, we have to talk to a cardiologist or a primary care doctor, can we switch? So there are some medications, the SSRIs, some of the antidepressants, anxiolytics can cause odd dreams. Tylenol PM. Those medications can cause odd dreams as well. Yeah.
What about lucid dreaming? Is that good sleep, or is that
Yeah, so lucid dreaming. So we're actually using that therapeutically to treat patients who have PTSD and associated nightmares. So lucid dreaming is your ability to, you're in the dream, but you're aware you're in the dream. And so what we'll do is if somebody has a pattern in combat and they're reliving a combat experience, the therapist will actually have the person actually write out the new ending for the dream and rehearse it. And then when the dream comes up, when we get to a certain point where the really awful things happen, you've rewritten the storyline, and that changes the target of the dream. So yes, that is a strategy that is being actively used by the therapists right now.
But when I got up, I went in, and my gutters weren't clean. They were done in my lucid dream, but.
Sorry, did that happen? We're using it as a technique, but does it happen? Yes.
Yeah. Now, is that good sleep or bad sleep, or?
It's sleep. And so it's just, you're aware that happens. We actually use that as a tool.
Well, I've been doing a lot of this kind of meditation stuff in this out of body thing, and when you're doing what is it, astral projection, is that good for?
So that might be what they refer to there. So in some of the metered, in the meditative states, yes, you can see that, and some of the meditative states actually cause the lucid dreaming.
Okay.
Yeah, go ahead.
Any apps that you recommend, as an example, they have them now where you actually can, they'll tell you a story so boring you fall asleep. Have certain music that plays for 20 minutes and it maybe doesn't cut off, that kind of wake you
So
up.
Calm Radio actually has a bunch of those, the Calm app, if you're familiar with that.
Breeze,
Yep, that's a good one. The other one I really like, give me a minute, I'll think of it. So the Calm one is the one that has the stories and those, they're actually not bad. If I were to pick one, that would be the one. Yes?
Can chronic use or repeated use of melatonin change the brain's ability to produce it itself? And is it different in adults as opposed to?
So we're not sure yet. That's an excellent question. So that's when I prescribe melatonin, I'm fairly targeted on it. So on my patients during the summertime, I usually have them take it on a nightly basis just to counter the impact of the summer light. But I'm a little bit reticent to recommend, like, oh yeah, just take every night for the rest of your life, because we don't know that. And we don't know the impact on kids long term. I mean, it's been studied, and there's no like definite for sure side effects. But like anything in life, our ability to know is limited at this point. And so just the cautious go around this because it for targeted periods of time. So like in the summer months, June, July, August, off. And then the winter months, I depend more on the light. Because the lights in the summer months are kind of pointless because there's so much light around, it doesn't matter. Right? Yeah. There is another really cool, unusual, so as we do sleep disorders, that's a funner discussion because we actually have videos of people doing things. But one of the interesting things I'll just make you aware of is, because you're asking about lucid dreaming, is dream enactment behavior. So people that are acting out their dreams at night, that is absolutely not normal. Okay. Right? And so that could give you a lucid dream. So you're aware, like, oh yeah, I was fighting this guy and I slugged him and accidentally slugged your wife instead. So REM behavior disorder actually can cause serious injury at nighttime because people are in REM sleep, they're reacting to stimuli that are coming here and behaving as if it's happening here. And so, I mean, I've had people launch themselves across the room and give themselves concussions, broken arms in the morning, like they wake up like, I have no idea how this happened. And or the spouse is hit or things are broken. And that is a sleep doctor evaluation because there's some serious medical problems that can be associated. And those people actually show up in acute care centers and in ERs, and people go, oh, that's kind of an interesting novelty. I don't know when that happens. And you're probably fine, go home.
I got one more that was from the start, and you were saying lack of sleep will cause depression, but depression will also cause lack of sleep,
yes.
Right? You can't, you got high anxiety and you're awake all night staring at the ceiling.
Yeah, the nuclei are very close to each other, and there's this very tight relationship between sleep. In fact, if you study patients with chronic depression, and you actually look at them as a large population, you'll see that most of those people actually have started having difficulty with sleeping 10 years in advance to the onset of depression. So there are researchers out there right now that are looking at, so if you can identify people that are having X kind of insomnia at an early age, could you prevent depression at a later age? And yeah, so there's a very tight relationship.
Yeah, that answers another question that I'll get.
Okay.
Yeah,
yes.
Are audible sleep patterns like loud breathing at sleep time necessarily related to sleep apnea, or are there other things that make people?
Yes, there's other things that could cause them.
Blowing bubble kind of things.
So all sorts of weird things can happen at night. So then some of them are normal. So our breathing in non-REM sleep is nice, regular breathing. You can tap your foot to it like a really good piece of music. Okay. In REM sleep, our breathing, our heart rhythm, our autonomic system becomes irregular. So that's what breathing is. It looks like it's breathing. You may actually see somebody who might be pausing at night when they're breathing. It depends when you're observing the person and what stage of sleep you're in. Now, I will tell you, because I have the ability to look at a polysomnogram while somebody's sleeping, and actually watch them on the video and see if they're breathing. And my ability to predict whether they have sleep apnea without the polysomnogram or the home sleep apnea test is terrible. I can't watch somebody and like, oh yeah, that's sleep apnea. I can't say for sure. And therein lies the rub. Because it'd be great, it'd be cheap, it would be cheaper as a country if we could, from a medical perspective, we could diagnose people with sleep apnea without doing sleep tests. It'd be way better.
Well, my father, for example, I could he would be sitting in the chair again, would sit asleep and would stop breathing for up to 20 seconds.
Yeah, that's more likely to
Many
sleep
times.
apnea. That would be more likely to sleep apnea.
Yeah.
They could be hard to tell.
So how about catch up sleep? Why do you think catch up sleep versus going to bed at the same time and getting up at the same time?
You're better off going to bed at the same time. So there's no, you cannot bank sleep. It's not possible. Sorry. Yes.
What's the best position to sleep?
So the position that you're most comfortable in. So there's, and this, it's not a silly answer. Because there's people who are say, oh, I read in this magazine, like, it's easier for my heart if I lay on my right or left side. I can't remember which, but it doesn't matter. I mean, it doesn't. Now, it may matter in a case like if you had sleep disorder breathing, right? And sleep apnea can be worse in some positions. Or patients that have had chest wall surgery. Like I've had women that had like a mastectomy on one side, right? So if you have a mastectomy on the right, then this chest wall does not move as freely. And now if you lay on your left side, now you splinted the left side. And now what I'll see at night when people lay on their left side is their oxygen levels will drop because they're not breathing as effectively as they could. And it's the low oxygen levels that are disrupting their sleep. But it's an anatomic thing that's waking them up. It's the low oxygen levels.
Well, we had I can't remember who he was, but in one of our older classes, a chiropractor told us we should sleep with a towel behind our neck with our head like this.
Right. So that's so that is looking at the world through one pair of glasses. So he's a chiropractor thinking about your spine and aligning the spine and relaxing the cervical muscles and opening up the neuroforamina so you get nice nerve signals up. But your spine is attached to the rest of your body, including your airway and your lungs. So in the case of that, you could lie on your back because of gravity, the tongue and the soft palate can drop back. So you actually be setting you up in a position where your sleep apnea would be worse. So, yeah. So I'm not saying, he's wrong from a spinal perspective, but from a breather perspective, I mean, we have to think about, like, right, is this somebody who has sleep apnea? Could they have sleep apnea? Should they not be sleeping on your back for other reasons? And that's what I said. So I'm not saying it's wrong. It's the bigger picture, the bigger context is important.
How about one more question?
Yes.
Why does the continuous pressure, air pressure in a CPAP machine, allow one just to go to sleep immediately almost? Is it classical conditioning? Or?
It is. Yeah. It's a cue, and you or whoever has taught themselves that that's I put my CPAP machine and that's when I go to bed. I grab my teddy bear and I'm ready for bed. And so do not underestimate the power of classical conditioning. I mean, it is a real thing. Your brain is set up to do this, and you can either have yourself become a slave to it and actually get into really weird behaviors, or you can leverage it in your advantage and force it to get the kind of sleep or whatever behavior you're looking for to get a lot of it. And there's people who can help you do that if you need help doing that. But it's not, that's why I list it as the number one thing you can do, because it's such a powerful thing. And again, the study where you took the patients with insomnia, took them to Estes Park for 2 weeks, people with chronic insomnia, took them to Estes Park, put them in cabins with no digital media, no artificial lighting, and almost all of them were sleeping between 9 and 9:30 to 6 to 7. And these are patients that were chronic insomnia, multiple sleep aids over years, alcohol, the whole thing, and these people were sleeping wrong, which tells me that it's possible. And I mean, you wouldn't see stuff like that in the publishing. Yeah.
LEDs.
Sorry, LEDs.
Yeah.
Yes. Yeah. So again, it's the blue spectrum light you want to watch for. Some of the LEDs will emit blue spectrum light, some will not. I'm not an electrician. That's not my wheelhouse necessarily. But I know that what I just told you is true. when you buy the LEDs, I mean, I would just be conscious of like, when am I going to use this light? And if it's going to be at nighttime before bed, I'll probably buy one that does not emit a blue spectrum light. Whereas in the morning time, oh, this is my night, because I study in the morning, so I do have an LED light bulb on my study lamp by my desk in the morning when I study. And I think it helps. Perhaps it's placebo effect. One last thing. These are great questions.
Good presentation. And my question is, are we keeping you up for it?